I really didn't think about getting involved in transgender health until I was a chief resident in San Francisco. But it was a few trans patients that I was taking care of as their PCP who felt that they didn't have anyone else to turn to in terms of how to best manage their healthcare, their long-term health, the stigma that they were facing in healthcare. And I went to the literature and saw that the Endocrine Society had guidelines for gender-affirming care. At the time, I thought gender-affirming care was primary care and still think it's primary care. I just thought it was really cool that they took charge and said, hey, this care is important, it's medically necessary, and we need to have guidelines that we can update occasionally to provide the best practice for our patients.
I think probably Sean's biggest attribute is just how much he cares about the community and wants to do right by them, wants to improve their overall quality of life. And through the research that he does by looking at the effects of hormones or effects of gender-affirming healthcare in general, how do you just improve the lives of transgender people and do it in a safe way?
I've known Sean since he was a fellow. He was one of the co-founders of our integrated transgender program. It was a labor of love over many years and many meetings from psychiatry and internal medicine, gynecology, plastic surgery, support from UCHealth in the hospital, and then us in endocrinology. And our goal was really to get out of our silos where we were all providing gender-affirming care, but in kind of a very siloed way. So we really tried to develop a patient-focused one-stop shop so that they would know that they had multidisciplinary people caring for them.
Before, patients were seeing multiple providers on different days, having to take time off work on different days. So we wanted to make it just easier to get care.
Sean is a very empathetic person, but he's also a very competent person. Working in our integrated transgender program, a lot of our patients are just looking for someone who has the experience and the knowledge to provide the care that they need. And I think Sean is able to provide that better than pretty much anyone that I know.
Sean has had a big impact in the community that he serves. I mean, for me, he has been a guiding light through my transition. He has helped me. Also, I know that he does a lot of research on issues affecting us. He has moved transgender health care forward many, many years with this work and with his dedication. I love Dr. Iwamoto.
The environment that exists currently for gender-affirming care, it's a very stressful time. The most difficult thing recently has been for individuals coming to us to initiate gender-affirming hormone therapy. The federal government has cut off the ability for us to do that. So Sean acts as that, I would say, comforting resource to figure out how those people can get the care they need. And of course, you can imagine that could be mentally distressing for someone to realize that this thing they're hoping to happen to make their life better and to be the person they want to be is not available to them.
It's important, especially in this time, for us to remain visible and remain steadfast in the things that we think are important. And one of those things being, our community and not losing sight of that. And I think that's what Sean's story has been up to this point. I think that's what Sean's story will continue to be.
His enthusiasm has never dampened, even in this climate where it's hard.
The research mission is certainly under attack, as well as our clinical missions. And I really hope that the next generation of physicians and also community members can really see the work that Sean is doing and be inspired by that.
I think as organizations or other clinicians limit care to trans and gender diverse people, I hope that by being present during this time, we can look back and say, hey, this group of providers, both where I work, in our state, we kept going and we pushed through, and we'll look back on the other side knowing that we did what was right and we saved lives.